long bone, all of you know about it. It is having the upper end shaft and the lower end. Upper end, you can see that there is a head and there is a neck, and this neck is connected with the shaft of the, this is the shaft of the humerus. Now what are the important point here? We have two tuberosity that is very important. One is the greater tuberosity or greater trochanter, and the lesser trochanter. These two are very important here for the attachment of the muscles. Now if you see the greater trochanter, you can see that it is having the medial surface, the lateral surface, and the superior border. So how it is going to be asked, they might ask you name the muscles which are attached to the different surfaces. So for example, lateral surface, what are the muscles attached to the medial surface and to the superior border? So remember this. And then for let's go to the lesser trochanter here. Now lesser trochanter is again important bony landmark because it gives attachment to two very important muscles. It gives attachment to the iliopsoas muscle. Iliopsoas muscles, they are called collectively because they are attached to this lesser trochanter together. So we have iliacus and psoas muscle, which are the muscle of the anterior compartment. They are attached on the lesser trochanter. Now coming to the shaft, you can see the shaft. This is the anterior surface of the shaft, which is almost flat. You cannot see any border over there. And this is the posterior surface where you can see one border, that is the linea aspera. So linea aspera is important here. This is the posterior border of the femur, and you can see that the linea aspera is having two lips, which you can see in the center. They are close together, but in the upper part and the lower part they diverge from each other. And for example, if you trace this border of the linea aspera downward, you will see that they move towards the medial and the lateral condyle of the femur. So if you can see that these are the lower end of the femur, and they are having the medial as well as the lateral condyle. So when you trace down the two lips of the linea aspera, you will see that they are moving towards the lateral and the medial condyle of the femur, and similarly they are called as lateral supracondylar and medial supracondylar line or the ridge. In the lower part of the medial supracondylar ridge, you will see a tubercle here, and this tubercle is known as adductor tubercle. And this adductor tubercle is for the attachment of adductor magnus muscle, which is muscle of the medial compartment of the thigh. So here again, you have to know about the linea aspera. What are the muscle attached to the linea aspera? Now, apart from these things, you can see here that when you trace the linea aspera above, you will see there is a rough area that in this side, you can see that there is a rough area, and this area is called as gluteal tuberosity, and this gluteal tuberosity is for the attachment of the gluteus maximus muscle. This is about the femur.